New at 5, a health scare for thousands of people in our area. A local hospital says it may have misused insulin pens, possibly exposing patients to serious disease like HIV and hepatitis C. Hi, everybody. Glad you're with us tonight. I'm Darren Kramer.
And I'm Ann Craig. It's all happening at Griffin Hospital in Derby. In fact, the hospital says people could have been exposed over the past 6 years, and as recently as last week.
Yeah, the problem is that pens may have been reused on more than one patient. We've got your back tonight with team coverage.
Health reporter Jocelyn Mementa has more details on those insulin pens and what patients at risk can do. But we start tonight with Josh Scheinblum, who was at that hospital news conference. Josh?
Darren and Ann, hospital administrators say after a week or so in investigation, they've uncovered a big issue. Some patients seeking treatment for diseases like diabetes may have been exposed to other illnesses.
There's a sheath covering the needle as a safety device to prevent needle sticks, and now you can inject the patient.
This is a flex pen, a medical tool used to help treat those in need of insulin.
We refer to this part of the pen device as the injector.
It's one of the latest innovations in injection technology. The reason being, because unlike a traditional hypodermic needle and syringe, where the needle remains exposed to the elements even after it's been used, in the case of the pen, after medicine is delivered, the needle retracts. Each pen, however, is only supposed to be used by a single patient, because when it's not,
there could be contamination, which creates the possibility of disease transmission.
It's what the hospital officials you see here are worried may have happened at Griffin Hospital in Derby.
A nurse may have taken the injector, meant and prescribed for me, and when a new patient was admitted to the unit and their pen didn't yet come up from the pharmacy, they may have taken this injector, a multi-dose injector with a clean needle cartridge, and used it for another patient.
From September 2008 to May 2014, they believe as many as 3,149 patients could have been exposed to pens that were erroneously used, putting patients at risk for diseases like hepatitis B, C, and HIV. A scary reality, but one doctors say they're confronting head-on, working to minimize any damage that may have been caused.
I think the first thing we're going to do is obtain baseline testing. There is a potential for what we call a window period, where we may not, in the first couple of weeks to months, may not pick up evidence of a positive of an infection.
Testing isn't the only work that's being done to mitigate the situation. Coming up tonight at 6 p.m., we'll tell you what other efforts are underway and how a potentially dangerous situation like this happened in the first place. In the New Haven newsroom, Josh Scheinblum, News 8.